Today, we'll be diving into the mental health impact of hidradenitis suppurativa, also known as HS. We'll dive into the literature as well as various patient resources. As always, this is for informational purposes only and not medical advice. Thank you. Welcome back, everyone. Today, we're going to talk about hidradenitis suppurativa, HS, as it relates to our mental health. So, this is my website. You can find the most recent article here. Here's a little diagram to show all the ways that HS, this debilitating condition, can impact our mental health. It can lead to emotional distress, depression, anxiety, suicidal ideation, disruptions in daily living, such as with work, relationships, strains on personal connections, and even impacting sexual function and intimacy. That's all highlighted here. We can have a negative body image. We can isolate socially. We can feel frustrated and hopeless. There are so many negative mental health and social implications of HS that I think it is one of the most important conditions to treat aggressively to allow our patients to live a full, fulfilling, and happy life. So, resources and support. If you know someone with HS or if you have HS, please come to this website. You don't have to do anything other than come to this page and look at the online resources and foundations that are available. Whether you want a support group, whether you want to join events, whether you want just someone to provide resources on how to navigate certain complications with HS. If you want to find a provider, that can all be found here on the website. There are so many resources and so many communities for patients with HS. Now, I wanted to highlight a couple different things. That's it for this article. I wanted to highlight an app. I have no conflict of interest. I don't make a dime from any of this. This app is called Papaya. I don't know why it's called Papaya, but it is a patient support app for those with HS. So you can do symptom tracking, treatment tracking. You can take photos and monitor your disease. You can send this information to your physician. You can bring it to the clinic and show them just what's going on. You can identify flares. And then likewise, in regards to the community, you can find support groups. You can access the guidebook. You can look for conferences and up-to-date articles regarding HS and even clinical trials. There's so much that you can find with this app, and it's a beautiful resource provided by the HS Foundation that I implore all my patients to consider downloading it and trying it out for themselves. They even have a guidebook, a patient guidebook, that I will link on my website under ebooks for patients with HS. So if you go down here, I'll just show you the table of contents, just the breadth of information that this free ebook can provide. So how do you know you have HS? Women and children with HS, multidisciplinary care, the various medications that we talk about in other videos, surgical procedures, pain control, laser therapy, an HS toolbox. There's so much provided in this free ebook, so I implore everyone to download it, read it if you'd like, or at least have it in your back pocket if you need it in the future. And then finally, another company that I swear by, that I tell my patients by, that I do not make a dime from telling you about is called Hidrawear. It was made by a patient that had HS. So this company makes undergarments like underwear and shirts that act as a wound care system. They allow you to navigate wounds, whether it's a draining, painful wound on the axilla, the armpit, or in the groin. You can wear these undergarments. They have slots for dressings. You can securely fasten them. There's no harsh chemicals, no silicone. You're not going to injure the skin. You're not going to rip off the skin. You're going to be able to navigate your day-to-day without worrying about bulky dressings moving, draining, and ruining your clothing. This can all be improved with undergarments like this, with the Hidrawear service. This service, you can pay for it out of pocket if you like, but it is also covered by many insurance companies, including Medicaid. So you could take this information to your physician, and you and your physician can navigate getting this for you under your insurance, as it falls under wound care. And if there's any pushback, please come to their website. You can look at the resources. You can see that there's clinical trials showing that patients experience improvement in their quality of life. The dressing changes were quicker, easier, and less painful. So Hidrawear is another resource in addition to the Papaya app that I recommend all HS patients at least look at once to see if it's right for them. So that's it, a very short video. I hope that was helpful. If you know someone with HS that might benefit from these resources, please send this video to them. If you have any questions, please let me know. As always, thank you so much and have a nice day. Bye-bye.